This week's topics revolved around the idea of behavioral change, patient engagement, and preventative care. The paper on behavior change described how patient engagement and continuous feedback can lead to positive, healthy behavioral changes, such as smoking and poor diet in people. One thing that stood out to me in regards to the paper was the fact that they only looked at internet-based interventions. I think looking at mobile device applications and text-based interventions could provide some key insights into how people can be affected by techniques focused on behavioral change.
Relative to health informatics, patient behavior and habit development play a large role in the integration of technology into the medical field. Most notably, this can be seen in the usage of wearables and other tracking devices that record health-related information. So the question arises, why is patient behavior and habit development crucial to the integration of technology into the medical field? Well, as shown by many New Year's resolutions being failed within the first 2 weeks, people really have a hard time fully adjusting or adopting to change, whether it be physically or mentally. Wearables and other health tracking devices are a commitment that not everybody can really embrace, and as a result, information being tracked by these devices it can also be not as reliable and could cause further issues down the line. Furthermore, while technology is being advanced to make wearables more convenient to users and integrate them easier into people's lives, there becomes a growing issue of whether or not the information being recorded by technology is necessarily the correct information. This is also a really subjective topic, as you can really have a million wearables and devices recording information about your body, but if none of that information is like really useful or provides insight, and it's basically pointless. Unlike new iPhones and smartwatches, uh, wearables and other health technologies are not a trend that can just fade out of existence. They're a commitment that can save lives.
In the past, managing your own health basically just consisted of going to the doctor. Now there's so many new technologies that add on to that and make it easier than ever to manage your own health. There's things like social media, there's access to information through the internet, and there's data tracking apps that make it easy for a patient to stay healthy without having to go to the doctor. I think the wearable respiration monitor that UCI is working on is another way to increase patient engagement. This device can give people with respiratory conditions an easy and effective method of keeping track of their breathing. I think people tend to put off tracking their own health because it requires going to the doctor. So this device may provide a way for people to make sure they're healthy while not forcing them to go to the doctor for every issue they may have.
Okay, so the data that are gathered from a person or user can be important and critical information. However, the way we gather this information can be in better ways. As Michelle Kynes, UCI professor of biomedical engineering, developed a wearable disposable respiration monitor to help children with asthma. Her idea of creating those new devices came from the birth of her son, that it was way too complicated for newborn baby to monitor respiration data. I think it's also really important to think about how information can be obtained and not how we use them, as we talk about in the past lectures. And this innovation can change a patient's point of view to the new device and also give more trust towards how the data being used in medical treatment.
I also found Michelle Kine's talk in the article that talks about her work with developing inexpensive disposable sensors to be very interesting. I think that the development of these sensors has the potential for a number of uses. One thing that came to mind for me was in this area of sleep monitoring. These sensors could provide key insights into sleep readings that current smartphone apps can't read and can be less cumbersome than other equipment that can be currently used to monitor your sleep. Looking at how much REM sleep a person gets or being able to wake up a person at a time when they are not in deep sleep can be very useful in improving someone's focus and productivity. Some things were of concern, however. Some questions such as how accurate are the readings and do we know that what we are monitoring is exactly what we want to monitor? Also, how will outside factors affect the sensors? Things such as sun exposure, heat, cold, or interference from other devices could have some effect on these sensors. In conclusion, though, the sensors could provide very key insights into how people function and can save a lot of time.
So this week in class, we started off talking about some behaviors that we would want to change, either for ourselves personally or as public health professionals or informatics professionals. And I think it's important to remember that at UCI, we do have access to a lot of resources and a lot of people to look up to. And I think one such example is the UCI biomedical engineers who developed a respiratory monitor using a children's toy. And this device was able to measure both respiration rate and volume. And I think the most inspiring part about that is that the professor who's in charge of that research actually got that inspiration from her own newborn child who was in the NICU and who was wrapped up in so many wires, and they could still only tell the respiration rate, not the volume. So I think that's a really good example of how a lot of times we find needs that aren't being met through our own personal experiences and interaction with our environment, and that our ideas can come to fruition and they are able to make a difference.